You know, there may be a time when you or somebody in your family needs to have some rehab done, you know, from an accident or surgery or something like that, something, you know, temporary. Well, what you do is you come here to Singing River's Assisted Nursing Facility in Pascagoula at Singing River Hospital. They've got a wonderful, wonderful facility here, and we're talking to Amy Rogers, who is nurse practitioner. How are you?
Hey, nice to meet you.
Nice to meet you. Tell us first of all a little bit about yourself.
Well, I'm from Mobile, and I started working with the system around 2011 with the hospitalist group and transitioned into doing nursing homes and long-term care with our geriatrics program.
Now, here you have the skilled nursing facility, Singing River Hospital, which is basically, you know, a part-time kind of thing or temporary, so to speak. It's not a permanent thing. What sets this rehab facility apart from any others along the coast?
Well, we are a short-term rehabilitation facility, so nobody lives here long-term, but we are the only 5-star facility on the coast that was accredited by the Centers for Medicare Services. We have the lowest patient-to-nurse ratio, which is 1 to 9, and we have different ancillary services available since we are in the hospital. So more access to radiology, lab, phlebotomy, things like that.
And the nurses are on staff 24/7.
Yes, sir. Nurses are 24/7. There's always access to a registered nurse.
That's awesome. Now, as I mentioned, you know, there might be a time where you need something, whether, you know, temporary because of surgery. What kind of medical conditions would deem someone to have to use this facility?
Well, it's usually anybody that's been in the hospital for a period of time from acute illness, surgery, or any trauma like falls. So we are short-term, and these patients they're getting better, but they're not back on their feet yet. So we continue with their wellness journey, but also get them physically ready to go back home.
So if they've been in a bad accident or something and spent time in the hospital, then the next step, you know, to go through rehab is to come here.
Yes.
Okay. I was watching a thing recently. Jeremy Renner, the actor, he was in a bad accident. Then after he got well enough, then he went through rehab. So hopefully you won't be in a you know, in a snowcat accident or anything like that. Don't think you'll have that down here or anything. What type of therapy options are available? I mean, there's so many because, and depending on the situation, but what type are available?
Well, everybody's been seen by 3 disciplines of therapy. So we have physical therapy, which helps you get back walking. Occupational therapy works on your activities of daily living. So that's dressing, grooming, hygiene, toileting, standing, going from bed to chair. And then there's speech therapy, who works on speech, swallowing, and cognition. So all those sequencing things that we have to do, some of our older adults are slower to process that, so they work with that sequencing and coordination.
Yeah, things that we take for granted on an everyday basis, things that you and I are able to do without thought.
Right, it's putting one foot in front of the other, making a turn, what kind of body mechanics you need to have.
Making a cup of coffee, you know, or just pouring a glass of water. These are things that, you know, your rehab kind of helps get that memory, you know,
triggers muscle memory
and everything going back again, because, you know, sometimes that leaves you. I hate to say it, but the older that we get, it leaves you quicker. So I mean, because I'm right in that boat. Are patients currently being accepted here?
We're always accepting referrals, and admission is based on insurance pre-qualifications and
depends on the condition.
And yes, your condition.
Okay. If they want to learn more, I guess, do they have to go through their doctor? Does the doctor have to recommend them? Or
usually, if they're in the hospital, they'll be seen by physical therapy, and they recommend if they need more inpatient physical therapy, so they would send a referral to us. Or we've had some referrals from home health agencies, primary care physicians, for people that have gone home but are still too weak to care for themselves, or they're too much for their family to handle.
So it's you know, again, if this is short term.
Short term.
Based what, a week, 2 weeks? Just
our average length of stay is about 20 days, but we have some that go home within a week or 2. We have some that stay up to 100 days. It just depends on
the situation,
what's going on, and then your functional limitations and what you need to be able to do to go home safely.
Because everybody's going to be different.
Everybody's different.
Everybody's different with that. Well, we want to show you one of the rooms that they have here at the new Singing River Skilled Nursing Facility in Pascagoula. Now, this is a new wing that you have here.
It is.
So you got more beds to add.
Right, so we're a 54-bed unit. This is our new hall that we're hoping to get some patients in real soon.
Now, and this is one of the rooms. We're going to take you in here to kind of take a look.
Here's one of our patients' rooms, so everybody has their own individual room.
Ooh, that's soft. I like that. I feel like breaking a leg just so I can come in here and get rehab.
Everybody has their own bathroom.
And a nice little view outside. Still get some sunshine. So, but yeah, everything is kind of spacious in here, and it's not cramped in real. We got the shower.
Yeah, step-in shower. Every room should have a bedside commode, so in case you can't make it to the toilet or you need those handles to help you get up.
Right. And you know, they have TV, watch TV, and of course then you have a camera on the people too. So just to make sure they keep an eye on you, in case you do have a fall or something like that. Well, we wanted one of the areas to have is the rehab center.
Yeah, but this is the therapy gym.
Let's go down and check that out
right.
here. Well, we're in the therapy gym now, where
Yes.
all kinds of different therapies. People, you work with people. Tell us about some of the things that they do here.
So we work on sit to stands. That's difficult for some people, especially if you've been in the bed for a while. Walking, work on stairs. Some people have stairs that they have to get in to be able to get into their home, which they're unable to do when they first come. They work on different coordination tasks, throwing the ball or like these pin games that they play.
What kind of tabletop games? The pin games?
The pin games and standing balance activities where you move an object from one spot to another.
Yeah, because a lot of times, as we mentioned earlier, you know, when you go through some traumatic situations, it's like almost like you're starting over. You have to learn how to do these things all over again.
That's right, and especially the older we get, it takes longer for us to get back to where we were.
If they want to find out more information again on this, what can they do?
So we're the skilled nursing facility over here at Singing River Health Systems. They can give us a call at 228-809-1131. They can find us online at singingriverhealthsystem.com.
Okay, and this is the skilled nursing facility.
Yes.
It's actually on the east side of the hospital. But again, if you you know, are needing some physical therapy, you know, you're in something traumatic or whatever, what you can do is go online and find out exactly what they need to do to get set up.
Yes, sir.
All right, Amy, thank you so much for your time. And again, if you need some help with this, Singing River
Skilled Nursing Facility.
Nursing Facility here at Singing River Hospital in Pascagoula.